Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 264,113 confirmed cases of COVID-19 in Canada and 80,690 cases in Ontario. Chatham-Kent has 422 cases and Sarnia-Lambton has reported 380 cases. Michigan now has 207,794 cases, with 16,220 cases being in Detroit. Today, we are reporting 20 new cases of COVID-19 in Windsor and Essex County. Of the 20 cases, 13 are close contacts of confirmed cases. 2 are travel-related outside of North America, and 5 are still being investigated. We have had 2,943 cases since March. 2,745 cases are now resolved, and 113 cases are active and being followed by our health unit. 1 person is currently in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are currently 4 long-term care and retirement homes experiencing a COVID outbreak. There are no workplaces or school outbreaks. However, we are working with several schools that do have cases. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit the number of contacts you have. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue to use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Testing is available by appointment at selected pharmacies and assessment centres. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 testing and assessment centres. Windsor Regional Hospital, Aulette Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. Yesterday, the province of Ontario reported the highest daily case count of 1,328 cases since the beginning of this pandemic. We in Windsor-Essex had a pretty good run with our low number of cases in Windsor-Essex, but this is starting to change now, as we have now reported 67 cases in the last 4 days only. I want to make sure that we understand that these cases remains low only when we are following the public health measures and adhering to the 2 meters physical distancing, limiting the number of close contacts, avoiding social gatherings and parties, wearing face coverings when physical distancing cannot be maintained. We are now becoming aware that the people are not following many of these recommendations and thinking that since the cases are low, they can participate and engage in high-risk activities. This is not how we should approach the low cases. The number of close contacts each one of us are having is increasing at a rapid rate, and the parties, social gatherings are happening much more, leading to many more exposures and putting many people at a much higher risk of contracting COVID. Even in the situation when one person gets sick, if they are not engaging in many of these activities, the case count do not increase substantially. But in these type of settings, when even one person, if they go on to attend, let's say 2 or 3 different parties, all of those people are exposed now, and all of those individuals could potentially turn into a case. That's how we can easily see the number of cases increasing in our region, which on an average now in the last 4 days, it has already coming close to 20 cases a day. We need to understand the basic principle. The cases still exist in our community. It hasn't gone away. Even though with low number of cases, the cases still exist, and the number don't add one by one, and we won't get a warning before we start to see large increases. In our community, COVID cases, we know and we have seen increases exponentially and is highly dependent on the high-risk close contacts. With people having more close contacts and participating in social gatherings, we are putting ourselves at a risk of contracting COVID, and also spreading it to others unintentionally. All of this can easily take our entire region to further restrictions, potentially overwhelming the healthcare system and increasing complications and deaths associated with COVID-19 in our region. The warning bells are ringing loudly now for us, and we have to pay attention. We still have the opportunity to reverse the direction where we are heading, but we need to take action today. Please follow the public health measure at all times as been told every day to you. No more social gatherings, please. Peel has already put formal restriction on these. We already have a limit of 10 people indoor. We definitely want to remind people that all of those social gatherings are an increased risk for contracting and spreading COVID. Limit close contacts to only to your household members. Maintain your physical distancing at all times. Doesn't matter who you're meeting. Anyone who doesn't live in your household, maintain your physical distancing at all time and wear a facial covering when in contact with everyone else when physical distancing cannot be maintained. Avoid indoor gatherings with people who do not live with you. Connect with friends and family virtually. That's the only way we can keep ourselves safe, keep our community safe, keep everything going in our community. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CBC.
Hi, Dr. Ahmed.
Hi.
With case numbers seeming to rise locally and about 29% of recent cases being contracted in the community, according to last Friday's briefing, what does this tell us about how people are, picking it up in the community? Are people not following those guidelines when they're out shopping, for example, or is there something kind of lacking maybe in the practices that we're being asked to follow?
So there are a couple of things that is coming into our observation, and I know Teresa has been directly involved with the team, and we are getting some of that information directly from the team too. What is of concerning is the social gatherings that I was just alluding to. The social gatherings continues to be a concern, and we know that people are having those social gatherings despite the formal limit of 10 people indoors. People are still having those gatherings and thinking that because our baseline case counts are low, they can have those. No, you cannot. The baseline case counts are low because we have had all those restrictions and measures in place. And these type of events are a breeding ground. Indoor, with more people together in a situation when physical distancing cannot be maintained, that's what's driving the number. And even though people are saying that, yeah, we maintain that, and we know, and I have seen that too, people do not maintain physical distancing as much as they think. And people do not follow all those guidelines as we always talk about. And everyone thinks that, yeah, I'm doing my part. But in reality, if you observe them, they do not. And that's a concern. I think we need to recognize that we are still human. We cannot follow all those measures all the time. And that's why we have to have those systems built in place to ensure that if I'm not coming in close contact with anyone within their 2 meter social bubble, even if, let's say, if my masks are not appropriately worn out and if there are any gaps and spaces, I'm still trying to do my part in terms of preventing that spread or contracting it. And if I am washing my hands regularly as I should in this type of pandemic, we can still avoid that. But having seen many actions, I think those measures are maybe people are getting bored with that, but that's still our defense against this disease, which we do not have any treatment, which we do not have any vaccine, and that's the only way we can do that. And as I said this even in the past, even like who doesn't want those gatherings? Who doesn't want to socialize? But this is a different time. This is a different year. 2020 is probably it will go down big time in history in terms of how everyone reacted, every country reacted, how individually we reacted. And those are important measures to keep ourselves safe, to keep our community safe, keep our loved ones safe. And it is changing. And I just want to remind that maybe it's not worth it. Just as boring as it sounds, but we have to recognize that COVID is killing people. We need to understand that. We need to do our part to keep ourselves safe, keep our community safe.
Last week, I believe you said that the increase in numbers, was concerning. It made you scared. Seeing what the numbers still are, what is your general sense? What are you feeling? And where do you think we're headed in the next week or so?
Oh, I think with this pace right now, we're definitely headed in the wrong direction. Some of these information that we are getting with these gatherings, and some of the linkages with maybe potentially connected with Halloween. We said very clearly, doesn't matter about the high risk activity, doesn't matter about the children's, doesn't matter about whether they're going door to door trick or treating and how they do it. Some of these cases are coming from parties that people had, which is a concern because that's completely opposite to everything that we have said. We have categorically said no parties whatsoever. People can argue about, well, it's children and it's about them, it's about candies. I get that. I have kids too. But we are not talking about parties which adults are participating, and that is leading to all of these cases right now. And it's I don't know what to say. I think people should know better, and this is the time that we need to take more precautions. We need to do more to keep everyone safe. It's not the time to lose our guards. And what we have seen in the last couple of weeks, it is definitely heading in the wrong direction, and we should reverse the course right now. We have the opportunity before it gets to the point when we are unable to cope up with all these cases that are coming to us. We won't be able to track down all these contacts, close contacts, and then the disease will be rampant and widespread in our community. And again, even though we don't have that many cases in the hospital right now, but imagine if you have 100 cases in a week, and as we know, and this is our local data, I'm not talking about anyone else's data, 10% of our cases roughly needed hospitalization. So if we are getting 100 cases a week, if 10 of them go to the hospital, that means 10 people are not getting the services, the critical care that they need. Either we're talking about emergency surgeries or scheduled surgeries, anything. And then we also know that out of those people, our case fatality rate is roughly 3%. If 100 cases we are getting every week in our community, that means 3 people are dying every week too. So we have to take all of those things into consideration and think about where we are heading and what could happen. So these are the realities of our region, and when things are good, people probably are not thinking and paying attention, but infectious disease spread this way, and that's how you will see the impact down the road very quickly. And before you get to the point where it's unmanageable, we have to take action now to prevent that from happening. You cannot take action when you already have that many cases in the community, because that it would be already too late, and the cases will be spreading so quickly that it would be difficult for anyone to take a good handle on it. And we are seeing that in every region. We definitely don't want to see here. So my request again to the community, we need to act right now. It's already too late, but we still have time. We can change it. So please act now to change the course where we are heading right now.
Just another short question here. Is this something that maybe you guys are actively monitoring and might use to change our pandemic status? Like, is that something you'll do before the week is up if you see that the numbers are concerning enough?
Yeah, and I think that's another question that we are also talking internally as well, that how much information we are using to talk about our pandemic status. So our pandemic status still is in the medium category. We reported that over Friday. And even if when we are doing the numbers, I think we'll have to take a real good look in terms of where we are. Our team of EPI will be looking at that number this week, and if needed, we can update the status. But that's the reality. We already knew when we put ourselves in the orange category, we kind of anticipated that when you incorporate all that data, it means something, and there's no one single measure that we can take into consideration and project what would happen. So that's another thing that we are looking at it, that how we can use all of this data to maybe get a better understanding of what is to come. And as of now, I think our team is looking into it, and if needed, we need to change that alert level. But as of today, it's medium, but it's creeping up to the level of high risk in our area, and we definitely want to prevent that from happening.
Thanks, Dr. Ahmed.
Any questions from Blackburn?
You mentioned that you're investigating a few social gatherings. I know we've heard about one at the university. Any other specifics, or do you know how many cases may have contacted from that one specific party?
So we're still in the middle of that investigation. I cannot give you a hard number at this, but definitely we have information as we're investigating that there are many exposure that happen, and a good number of people came back positive. So we are actively investigating that, and we'll inform the community more when we have that information. We got large number of cases over the weekend, and our team is actively trying to gather all the information to help us with the investigation, as well as contain the disease in the best possible way.
So you've got that one specific party. Are you investigating multiple parties from Halloween weekend?
We are gathering all that information right now. I cannot say how many, but there are some evidence that that there are some activities that happened, some social gathering that happened that resulted in more cases. And we just want to make sure that we get all that information right. And if, a lot of information goes into place, whether this case, were they infectious while they attended the party, or was there anyone else who was in that party and they were infectious? So from a case acquisition perspective, so that's one aspect that we are looking at, and also from a case spread perspective. So we have to piece all that information together before we can say that. But yes, we are investigating a few parties at this time to see the total impact of that exposure, and the next steps for those individuals who attended those events.
Thank you.
Any questions from the Windsor Star?
Dr. Ahmed, just to reiterate, you said multiple parties are under investigation. Are those all on the University of Windsor campus?
Not really. I think we're still in the early phase of the investigation. We are investigating a group of students who attended a party, but there are other that could be outside of that. But again, some of these things I want to be very careful. When we start off with the investigation, we always think that maybe there's a cluster, maybe there are more people that we can link it together. But then when we get more information, sometimes that doesn't come out to be true. So I just want to be careful that, what we are investigation doesn't necessarily mean that it will result in the real spread or any concerns specific to that. We are getting more evidence, at least from the university one, that there are individuals who attended and who contracted. The true extent, we'll have to figure it out, and we'll report back.
But just so I'm hearing correctly, is a third cluster under investigation currently by the Windsor-Essex County Health Unit?
Well, I think it would be, I don't want to say it would be a cluster. It could be an outbreak too. So we'll have to see, we'll have to look at the evidence, because if the real issue is somebody who contracted and then they attended while they are infectious, they participated in that event, that resulted in further spread to just one single event, we'll classify it as an outbreak. But this is something that we are investigating right now. Cluster, yeah, we can say that, but then typically what we have reported from a cluster perspective is, one single individual attended multiple parties while infectious and then spread it to many other people, and then they go on to spread others. So I think we'll try to keep that distinction clear. But right now, the evidence is more about those isolated events, and we're investigating that.
Go ahead.
I already asked too. I'll wait until it comes around to me again.
Okay. Any questions from AM 800?
Dr. Ahmed, can you say, I'm not sure if I missed this, but did this party occur on campus or outside of campus?
To our understanding, it happened within the campus, and not authorized by the university. I think it was just the student who came together.
So if it happened on campus, and I've been in college and university for quite some time, but isn't there security? Isn't there different individuals that monitor the floors to see if parties happen inside residence? Are you disappointed that maybe no one shut this party down?
So there could be different ways that these parties happen, and again, Rob, we're still in the middle of that investigation. But sometimes what happens is, as if you recall your college and university time, it may not necessarily be a large gathering where everyone is coming. It could be like these small mini parties that are happening in different rooms, when people are moving from one room to another room to another, and then they just keep on going and still maintain that. And it may be hard to for anyone to enforce. So there could be a number of variation, but we're investigating all those possibilities. Some of these initial indications are not that it was not like a big open place party where everyone was invited and everyone attended. It was those events when people just get together, they came together, they went somewhere, and then they move on to somewhere else, and carried on with the number of people that they had, and just stayed more and more time with them in a high-risk situation that potentially led to the spread of the disease. So we are investigating that. I don't want to say that the university didn't do anything or the college didn't do anything. I think it's just everyone is trying to do their part, and sometimes, as I mentioned, people may think that, I'm doing everything that I can, but in reality, they're not. There's still lots of gaps that people do when they're following all these measures. So that's why it is really important that we keep that at the top of our mind all the time. What do we need to do when I'm outside? What do I need to do if I am with other people? So I think those measures are really important. And at this time, I don't want to say that, things were not followed. I think it's just we need to understand that we have to take our responsibility of our actions.
Sorry, one quick one here on that topic, but do you know how many students right now inside residence have COVID or are being monitored?
Rob, I really have to complete our investigation first before I can answer that question. We have, as I mentioned, we received large number of cases over the weekend. We got too many of those cases, but we are still getting all the number and all the information before we can say with certainty. So please bear with me, and I know it's I want that information too, but we're in the middle of the investigation, so I don't want to say something that I have to go back and correct.
Okay, thank you.
Any questions from CTV?
Yes, good morning, Dr. Ahmed. Hi, Teresa. Nice to see you again. So apparently there's a college case as well. So I'm wondering, is that a party-related case? Would you know?
I'll let Teresa answer that.
Yeah, not that I'm aware of for the college one.
Okay. And is it a low risk or a high risk contact? Would you know at this point, or are you still investigating that one?
The college actually has a case, and so
is it a low risk case or is it a high risk case? Do you know yet?
So all cases are high risk. It's the contacts that we determine if they're low risk or high risk. So.
Oh, okay.
Yeah, so through our investigation, we'll interview the case and determine who is a high-risk contact and then move from there.
Okay. Going back to the university party now, I don't know if the question's already been asked yet, but 13 close contacts today, is that party related? Is that connected to the University of Windsor at all?
Some of these cases are connected to the university. I'm not sure about all 13, but some are.
Okay. I guess, are we calling this party a super spreader? Is this party going to be a super spreader all of a sudden, or like how concerned are you guys about this?
Bob, I think we have to have all that information in place, and then we continue to investigate. So I think there are evidence that someone who was positive and during their period of infectiousness, they were at the party and they exposed other people, and some of those exposure that happened, it resulted in some follow-up. So I think we'll have to put all those numbers together before we can say that it could be a super spreader event or not. But right now we have 4 cases that we are investigating, but there could be others. And we can only say when we have all that information available to us.
Okay, great. Thanks, guys.
Any further questions from CBC?
Yeah, I don't know if you can say this, but I know that there's 4 Faculty of Nursing students from Windsor. Are those connected to the Halloween gathering that happened at the school?
We're still interviewing the cases, but they may have been part of this.
Okay. And then just another question here. I know that I think it was yesterday there was cases under investigation. Is there any clarity on those cases that were under investigation?
So yesterday we were following 32 cases yesterday, so that would have been from Saturday as well. So I'm not really sure at this time who everyone is, but we also have cases in some of our schools and following up on those as well. So a lot of cases came in on the weekend, and our staff are following up with not only the cases but all the high-risk contacts. So all the specific details about the people on the weekend, I'm not exactly sure which ones are, complete or not.
Okay, so it's still fair to say that those that were under investigation on the weekend are still under investigation?
Yeah.
Yes, I think they will have a better idea by the end of the day on where we are with all of the investigations.
Okay, thank you so much.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
Dr. Ahmed, if a gathering is determined to be prohibited, what potential penalties can the people involved face?
Well, definitely something that we will look into it, because we don't want these type of gatherings to go on. And again, we'll have to be very careful in how those, penalties are enforced. We have to be certain that it violated the social gathering requirements. And as I said, there could be event instances when people are just basically room hopping rather than having exceeding the number that is allowed. And but we'll look into all the possibilities, and if we get some more clarity, I think there should be some penalties and charges that should be laid.
Sorry, just to clarify, what kind of penalties and charges are possible?
Well, what we know is that for the indoor gathering limits, there's a 10 persons capacity limit, and if that 10-person limit is exceeded, there are penalties and charges under the Reopening Ontario Act, which could mean a $750 fine for the individual.
Thank you.
Any further questions from AMA 100?
Sorry, just to follow up on Dawson's question, would the penalty go to the individual that hosted the party or the property owner?
It should be to the individual, in my understanding, but we'll have to make sure that our team who does some of these enforcement, they'll provide us with the right advice. But my understanding is it would be the individual who hosted rather than the owner.
Okay, switching gears real quick. I'm not sure if this is for Teresa or for Dr. Ahmed, but in regards to the Keeping Ontario Safe and Open, the new framework that came out Friday, seems like there's a little confusion out there when it comes to bars and restaurants and last call. Where is last call right now? Can bars and restaurants remain open until 2 in the morning, or is it still 11 p.m. last call and they have to close at 12?
So Rob, we got the regulations just yesterday, released from the province, and our team is looking at it very carefully and comparing what's included, what's excluded, and how it all will shape out. The way I see it, I think we are in the orange status for us locally, which is a medium risk environment, even though the province is, I think provincial numbers are delayed. They put us in the green zone, but we are in the medium risk category, and looking at the numbers, we are there. So I don't see any reason for us to change that from what we are doing right now. Going back to specifically what the legislation or what the regulation says, to my initial thoughts, these regulations build upon what was said about stage 3 reopening. So whatever was in stage 3, all those restrictions are supposed to build on top of that. But at this time, I think the language, what we are looking at, those regulations are still, we're trying to understand it carefully, what the intent is, and we will be in a much better position to answer and provide clear guidance to our businesses in the region probably tomorrow. I don't want to misinterpret anything, but I think in the matter of safety of our residents, I don't want to see any changes at this time, loosening more restrictions. Status quo is different, but opening it more will increase more risk to our community. So I think we'll have to look at what the legislation and what the regulation says from the province and what our interpretation is. We know that some of the health units have gone above and beyond what the provincial regulation states. So we'll have to look at that, our local situation, and we'll have to see what works and what are our concerns in the locally. So we'll have to make that recommendation accordingly. But right now, our team is carefully looking at the regulations to understand and draw a comparison what is changed and what is not changed.
Will your team be speaking to the AGCO? The reason I bring that up is we talked to some bar owners that spoke to the AGCO over the weekend, and they got the green light from the AGCO saying they can open and serve until 2 a.m. So like you said, I know you're going through the entire document, but it just seems like there's just a lot of confusion on, I guess, both ends. And it's not fair for the businesses too, because they want to open till 2, they want to make money for their establishment. So like you mentioned, I know you're hoping to have some more information tomorrow, like you said, but I guess what would your message be right now to these business owners?
Well, again, I definitely don't want to create more confusion. We want to make sure that we are clarifying all of those things. My recommendation at this time for the businesses, if they wish to follow, and is to stay put, status quo, before we get more clarity and more understanding. The regulation was released just yesterday, and it will take us time to review all of that. And I would hope that until then, we don't get into a situation or we don't start doing things that we have to go back and change. So at this time, my recommendation would be to just stay put and wait for further direction. But obviously, it may take some time for us to do that today. But we would want to get back to them with some more clarity.
Okay, perfect. Thank you.
Any further questions from CTV?
No, I'm good today. Thanks.
Okay, thank you, everyone.
Thank you.